Hi, I'm Dr. Esther Benamou. I'm a researcher and infectious diseases specialist at the UC Health University of Colorado Hospital at Anschutz. As variants emerge, it's more important than ever to get a COVID-19 vaccine. The Delta variant is twice as contagious, and unvaccinated people are much more likely to get and spread the virus. At this point, you might know someone who has been hospitalized with COVID-19. With the vaccine, the chances of being hospitalized or dying from the virus go way down. It is your best protection from this terrible virus. I'm here to answer questions about the safety of the COVID-19 vaccine based on my research as well as my treatment of COVID-19 patients over the past 18 months. The three available vaccines, Moderna, Pfizer, and Johnson & Johnson. Are they safe? Yes. Tens of thousands of people have enrolled in clinical trials that have proven the vaccines to be safe. UC Health has participated in trials for two of these COVID-19 vaccines. No steps were skipped or shortened, and the vaccine development process followed the same process it would follow for any other vaccine. Recently, the FDA issued full approval of the Pfizer COVID-19 vaccine for anyone 16 years or older. To approve the vaccine, the FDA reviewed comprehensive safety and effectiveness data collected over more than a year, including data compiled during the Emergency Use Authorization period, known as EUA. It is also expected that full approval of the Moderna vaccine will come soon. The FDA's decision shows that the extensive data collected is clear. The Pfizer vaccine is both safe and highly effective. The FDA no longer considers this vaccine to be experimental. It has the same approval as any other prescription drug. Should those with compromised immune systems get the vaccine? Yes. UC Health and CU Anschutz Medical Campus researchers and physicians have participated in studies on vaccine effectiveness among patients with weakened immune systems, including transplant and cancer patients, as well as their household and close contacts. The results of these studies support the use of Pfizer or Moderna vaccines in immunocompromised individuals. The studies have found that patients' weakened immune systems often do not respond as effectively to 2 doses of the vaccines and may produce significantly fewer antibodies needed to fight off a real infection. There are now guidelines calling for these patients to receive 3 doses of the Pfizer or Moderna vaccines. We continue to encourage these patients to schedule an appointment for their 3rd dose when their doctor determines it is best to get it. They should also speak with their doctor if they have any questions. For those who have already had COVID-19, there's still a chance they could contract the virus again, so we recommend that they get vaccinated to protect themselves and their family members from severe illness and hospitalization. Should women who are pregnant get the COVID-19 vaccine? Yes, I am 30 weeks pregnant and I just got my vaccine. And the same goes for those trying to get pregnant or breastfeeding. Get the vaccine. I understand the uncertainty, as it took longer to understand the risks and benefits involved with getting the vaccine while pregnant, not to mention the danger of COVID-19 to pregnant people. Clinical trials for any treatment almost never include pregnant people, and the CDC was cautious at first in clearing the COVID-19 vaccine during pregnancy. They wanted to wait and see if it was safe. But now, with no evidence of health issues in more than 35,000 pregnant women who have received the COVID-19 vaccines, the guidance is clear. It is safe for pregnant women to receive the vaccine. Should children get vaccinated? Yes. The Pfizer vaccine was recently approved for children ages 5 to 11 after clinical trials proved it is safe. While children are at lower risk of serious illness from COVID-19, they make up a larger share of the new virus cases across the United States as more adults get vaccinated. Children can still have symptoms and spread the virus to the adults around them. People under 21 make up a big portion of the US population, 25%. If many children get a vaccine, the chance of herd immunity, meaning when lots of people are immune, goes up, and the chances of further spread go down. There are many safe and effective vaccines for children for diseases like whooping cough, measles, and meningitis. Providing vaccines for COVID-19 will become a standard measure of care to protect children. For information on how to get the free vaccine at any of the UC Health locations, you do not need to be a UC Health patient. You can schedule online at our patient portal and click on Appointments, then Schedule Appointment. To see a list of locations and hours, go to uchealth.org/COVID vaccine.